Hi, I'm Kristen. I run the London Climate Change Partnership. So I sit in the Mayor's Environment Policy team in City Hall in a smaller team that works on climate change adaptation. And although I sit in City Hall, my role is a lot more outward facing. So it's about coordinating activity among partners and stakeholders in London. And the purpose is to help people understand what the impacts of climate change will be, like on their own roles, their businesses, their communities, their objectives, and so forth. Um, and then to work together to share knowledge and ideas about how to manage the risks. So I'll say a little bit more about how London understands its climate risks and what we're doing about it in terms of policy and practice. And the focus is health and climate change, but here in London, we see all those things as being really interconnected and interdependent. So hopefully I can show here kind of how that works in London and convey how a broad range of issues and sectors can impact on health, well, both for better and for worse. And just to say quickly why we do this, I mean, we recognize that climate change and its impacts are already with us. And certainly if you've been reading the news over the last few months, you've seen unprecedented climate change. You've seen, wildfires in the Arctic and the Western United States, so many hurricanes that we've actually exhausted our naming system for them. So, climate change is here and we know that we need to deal with it. And here in the UK, we have not been immune. So just in the past few months, we've had heathland fires in Surrey, we've had flooding in Croydon, and I should just say that the flooding in Croydon occurred during one of the three hottest periods this year. I think we had 3 heatwave periods this year. And of course, there was a fatal rail crash in Stonehaven in August as floodwater eroded the embankment and undermined its stability. So one thing it's also important to recognize is that, yeah, we deal with London here, but even impacts that happen outside of London have knock-on impacts for us here. And so we need to keep that under consideration too. So what does climate risk look like in London? Well, in London, we see 3 major types of climate risk: flooding, heat, and drought. And here you can see an illustration of the numbers of residential and commercial properties that are at risk in London from surface water flooding. Surface water flooding is flooding from rainfall that overwhelms our drainage systems, and it's one of 5 types of flood risk that we deal with here in London. But it is by far the highest risk that we face. We see dozens of incidents, for example, in a single borough in the course of, a single rainy period. But unlike fluvial or river flooding, because the impact is so dispersed geographically and it's not happening at the same time, and because it's so unpredictable, it doesn't get the kind of media coverage and attention that you would see from, a big river flood, for example. And still, the impacts are really no less severe. We still see lost property, disruption and damage to people's homes and to people's lives. And the mental health impacts of flooding are severe and only really beginning to be understood. We hear about anxiety and depression, for example, about people being terrified when it rains. And so it's a bigger issue than sort of cold numbers of properties. But this type of quantification can also help us understand how and where we can target our interventions. Heat is also a really big concern for London and one that's increasing. So I think I mentioned before we had 3 heat wave periods in this past summer, and we saw the effects of that on services, on people in terms of discomfort and disruption. And according to Public Health England's recent numbers, I think which were released last week or the week before, we had a few hundred deaths here in London during those heatwave periods, and I think a couple thousand across the country. And how we experience heat and the health risks from heat has a lot to do with our buildings that we spend most of our time in, and that can be, the orientation or the quality of the building materials or the design, which can either use the heat from the sun in sustainable ways or create huge solar gains that are difficult to manage and which can cause problems for public health. We also have the urban heat island, and that means that the densest urban areas in the center of the city can be up to 10 degrees hotter than the surrounding rural areas. And this can be a benefit sometimes, at other times of the year, but during the summer it can cause problems. And it mostly manifests itself at night, meaning that people can suffer from sleep deprivation. That can lead to mental and physical health problems and reduced productivity and well-being. We also know that to have problems from heat, we don't even require a heat wave. In fact, we're aware that our building stock in terms of housing, but also critical infrastructure like schools and hospitals are already prone to overheating even in normal summers. So part of the reason we need to think about climate change adaptation is because we're not very well adapted to the weather that we already have. We also know that the impacts of heat and actually the impacts of all climate change, so all the different climate change impacts are not equal or fair. And I'll say a little bit more about that in a bit. But yeah, I mean, as with most risks, it's worse for you if you're poor. If you live in poor quality housing, if you already suffer from health inequalities, and climate risks are also going to exacerbate those inequalities. And finally, we have drought after flooding and heat, and although that's not in any particular order of importance. So this illustration shows our projected water supply demand gap over this century with sort of the continuing growth trends over the sort of foreseeable future. We know that we're going to need new water resources because even with projected efficiency gains, we are expected to have a water resource gap of about 400 megaliters per day by 2040. And this means that we just will not have enough water to meet London's needs in terms of drinking water, hygiene, industrial use, and so forth. So we've set out the major risks from climate change, but what are we actually doing about it? Well, the first thing in London is, kind of London level strategic policy. And so our environment strategy, which you see there on the left, contains a lot about climate change. It's no surprise there. But it's also got a whole chapter on adaptation, which just sets out the policies and proposals that we're going to use to manage the risks that I just mentioned before. But adaptation to climate change is not just an environmental issue, so we've tried to embed consideration of climate change impacts into our transport strategy, the London Plan, the resilience strategy, our housing strategy, even our food strategy. And so, for example, the London Plan, which is the spatial development strategy in London, that includes some strong policies on how to prevent flooding and overheating in new buildings. And the transport strategy sets out how we can manage climate risks to the transport network and to people using the network or just passing through its spaces. But the mayor's powers, like actual material powers to adapt London to climate change, are actually very limited. One power on climate change adaptation that the mayor does have is convening power, and we understand the importance of convening in partnership working on adaptation, and that's why a London Climate Change Partnership exists in the first place. So on health, we run a sector knowledge exchange group, and that includes people from public health, local and national government, the building sector, NGOs, non-for-profits, voluntary sector organizations, academia, and so forth. And the point is really to try and tackle the issues for health and for also not just health, but the delivery of healthcare services as well. And also to look at the wider issues around the built environment that contribute to the risks. So this group and members of the group have, as you might imagine, been sidetracked a bit by the pandemic this year. And so we were able to deploy that group to support Public Health England in producing and disseminating its new advice on managing the concurrent risks of heat and COVID-19. So we were able to put that guidance out in front of lots of different health practitioners and get their feedback on it and just really get that out there so that people could look at, what the potential implications are of managing a heat wave in the context of a pandemic. And as a partnership, we've also produced or been involved in producing guidance and decision support tools to try to help practitioners in different sectors make the links, thinking about their areas of responsibility and how climate change might have an impact on them. So for example, we created a guide for how to incorporate consideration of climate change into joint strategic needs assessments. And that came on the back of a previous assessment of climate change on impacts on the health sector in London. We also contributed to London's drought response framework, which is held by the London Resilience Forum. And as part of this, we helped run workshops with different sectors, including health, business, transport. And the point was to walk them through an extreme drought scenario, like the kind we saw a couple of years ago in Cape Town. to get them thinking about what some of the wider ranging and knock-on impacts would be. So although London resilience is really more about kind of immediate risks and responses, we can help them start to think about how more extreme events might play out. We also worked with DEFRA and other agencies and partners in local government across the country to produce some guidance for adaptation in local government. This looks across 8 different council departments or areas, including public health, and it tries to build a picture of what good adaptation practice would look like in those areas, because we know that, even within local government, you don't have a person who's necessarily responsible for climate change adaptation. But we thought if we could, kind of attach it to particular job roles and tasks, then it might make it a little bit easier to incorporate into their work. We also have produced some specific guidance for home retrofit for adaptation, and that's the document you see there on the left. And we then applied that in an actual retrofit of 2 social housing estates in Barking and Dagenham. And the document on the right was produced after that project, and that contains a lot of the learning from that project, along with a checklist of things that all retrofit programs should consider so that we can incorporate adaptation into existing retrofit programs, whether they're for energy efficiency or they might be for decent homes or what have you. And the UK Climate Change Risk Assessment names food security as a major risk from climate change to the country. And so in London, we wanted to look at that and see what it might mean for us. So here we don't see climate change necessarily as a direct threat, but it's more about indirect threats to our food supply because of disruption. Food insecurity is already a big issue in London, and at the moment, both the pandemic and Brexit are more immediate threats than climate change, and that's fine. I mean, we can still get involved in the work around those issues and learn lessons for potential future shocks and stresses that might come because of climate change. So we've been involved with scoping a study of London's food resilience with the London Food Board and working to consider how to protect the most at-risk populations, because actually there's not an awful lot that London can do about its own food supply. We're probably never going to get to a point where we're actually growing all of our own food in London, but we can identify kind of where are the most at-risk populations and the at-risk people and businesses and so forth, and think about what mitigation measures we might put in place to help protect them. And again, in terms of indirect threats, London Resilience created this way of visualizing interdependencies and the knock-on impacts and cascading failures due to disruption of infrastructure. And that disruption may or may not be due to a climate-related impact, but we can still learn from this kind of an exercise to help mitigate the impacts of climate risks in the future. So we've been involved in running workshops and disseminating this with London Resilience, and really just encouraging people to think about more than just the immediate and direct impacts. So I mentioned earlier about the fact that the impacts of climate change are neither equal nor fair. And we've worked for many years on projects that are trying to help understand the disparity in climate risks and how those manifest themselves geographically and in other ways, and also to try to promote and help people to consider social vulnerability to climate change in their policy and in practice. And in London, we've just created some new mapping of climate vulnerability, and you can see a little picture on the right-hand side there. And this uses metrics similar to some of the ones that you see on the left. And of course, again, they're, not surprisingly largely about poverty and deprivation. And so we've created this mapping, and now we're beginning to test it out with GLA programs like the recent Grow Back Greener Fund, which is where organizations could bid in for funding for greening projects in their areas. And the point of this is really just to help us target our work to support the people who need it the most, or at the very least, not to create further harm. And this point about not creating further harm is really important. It's important so not just when we're thinking about the risks from climate change, but also when we think about solutions. And here on this slide, you can see a good example of how a very well-meaning climate change-related intervention, which was intended to improve insulation and reduce energy bills, has actually been a disaster for health. Creating problems within homes with thermal comfort, overheating, and poor indoor air quality. And we see other examples of this as well, and examples of unintended consequences despite the best of intentions. So one recent one I see in my own neighborhood is the new low traffic neighborhoods. And these were conceived as a way to improve public spaces and increase access to nicer spaces. Um, but there's been a huge backlash against them from people who are concerned about being able to drive, or about ambulance access, or about the fact that traffic sometimes gets rerouted through what had been quieter streets. And so some of those complaints, are potentially more legitimate than others, but the backlash just highlights the fact that problems can occur when we work in our own little areas and we don't think about the wider interests and competing priorities. And so that just, again, reinforces the need for partnership working and coordination so that we're thinking across all of these different areas and making the connections between um, the different priorities that we all have. And that's me. So my details are there. So if you have questions or comments, definitely feel free to get in touch. Thanks very much.